My name is Trish Murphy. I'm with the Orlando Medical News, and today I'm visiting with my dear friend, Dr. Shah. Dr. Shah's the top dermatologist here in Orlando and a true leader in his field, globally actually. Dr. Shah, in some of the conversations we've had and visiting, you mentioned that one of the most common conditions you treat as a dermatologist is pigmentation. Can you tell us what is pigmentation and what's the most common pigmentation condition is that you treat?
Sure. Well, thank you very much, Trish, for visiting us today. I appreciate that, and thank you for the kind words. Pigmentation is basically how much melanin someone has. It's a measure of skin color in a person. There are various forms of pigmentation that we see or encounter as dermatologists. And one form, the most commonly seen, is hyperpigmentation, which is excessive pigmentation or excessive darkening of skin color than a person's normal skin color. And another example of a form of pigmentation is hypopigmentation. Hypo is less. So hyper is too much and hypo is not enough. So the examples of hyperpigmentation that we see most often in a clinical dermatology setting would be, for example, post-inflammatory hyperpigmentation, which is what we see from acne. So people that get acne spots or acne breakouts, then when the spots heal, they end up leaving dark spots. So it's more common in the darker skin population, such as Hispanics, African Americans, Indians, Pakistanis, etc. So they suffer a lot of that. The other form of hyperpigmentation that we see is a condition called melasma or cloasma, people call it. And often the nickname for that is called the mask of pregnancy. So a lot of, we see melasma in, for example, after pregnancy or women using oral contraceptives. That's a form of hyperpigmentation that we see quite often. About 90% of cases of melasma are females, but there are 10% of cases that are males. So it's not exclusive to women. So as I said, birth control pills and pregnancy, as well as environmental factors and other exogenous medications, drugs, etc., can lead to hyperpigmentation. And then hypopigmentation, one of the examples of that, or depigmentation, which is a complete lack of pigment altogether. So you have hyper, you have hypo, and you have complete depigmentation, which is your milk white color. So you have your off-white, which is the hypopigmentation, and then you have your hyper, which is the darker, and then the depigmented, which is no melanin at all in the skin. That is a classic example of that is a condition called vitiligo. So vitiligo is a condition where people start to lose skin color, and it's considered to be a condition from destruction of your melanocytes. It's considered to be an autoimmune condition. And so treatment basically for hypopigmentation versus hyperpigmentation obviously is completely different. So that needs to, we evaluate that.
So, Dr. Shah, what are the most common pigmentation issues that your patients come to you for?
Sure. The most common pigmentation in forms of hyperpigmentation is post-inflammatory hyperpigmentation, which is, from acne, or it could be bug bites if they suffer from bug bites, or they've been scratching or itching if they had a skin rash, and then they end up developing the dark spots afterwards. So again, in darker skin types that last longer. The other form of hyperpigmentation that is frequently encountered, and it's probably seen by most dermatologists worldwide, is melasma or cloasma, and again, that is the dark patches on the face, and it sometimes is very difficult. It can be epidermal, it can be dermal, or it could be mixed. So sometimes people get treatment for the melasma. The epidermal melasma is easy to solve, and the pigmentation does improve, and they get their their patients are happy. But sometimes if it's mixed where there's a dermal component, then that's a much more difficult condition to treat, and we get a lot of mixed and dermal melasma that comes in, or difficult post-inflammatory hyperpigmentation that may occur. There's also hyperpigmentation that is very deep dermal, and sometimes that comes in the form of a mole. So for example, there's a condition called nevus of Oda, which is a condition called, it's a dermal melanocytosis, where there's too much melanocytes and they fail to migrate all the way to the dermis. So they have this, it's a congenital condition, and with that, it's important to recognize it and have an accurate diagnosis. So treatment can be done with a special type of laser for that.
So can you tell us a little bit about what are the most common treatments you use for patients with hyperpigmentation issues?
Okay. For patients with acne, so this is very important to understand for our viewers and people that are watching in general, that you want, so whatever is the source of the hyperpigmentation needs to be addressed.
Okay.
So that is a crucial component of this. So there's no cookbook or quick recipe that one says, okay, so you have this, then we'll use this. We need to figure out, so for example, if it's acne, and acne is producing the breakouts, once those breakouts heal, they'll leave dark spots. That's the post-inflammatory hyperpigmentation. Patients are more bothered by the hyperpigmentation than they are with the acne. So they frequently will come in and say, doctor, can you please help me? I hate these dark spots. And we tell them, we need to find out and get your acne under control before we get the dark spots under control.
Oh, I see.
And that treatment is crucial. So we figure out and we try to treat the acne. Sometimes we can treat the acne and the hyperpigmentation simultaneously, but other times if they have hormonal induced acne or cystic acne, that acne needs to be suppressed first, and then treatment may be initiated for the hyperpigmented spots. So what are some of the treatments, as you asked? So I wanted to just elaborate what the underlying cause is. And then again, so for the post-inflammatory hyperpigmentation, we use bleaching agents. So examples are hydroquinone or alpha-arbutin. So there's different types of ingredients, licorice extract, for example. So some of these are prescription, others are non-prescription. So, and then also we use retinoids. So the classic example is Retin-A, which had come out in the 60s when it was FDA approved for acne and also for wrinkles. So it's an excellent medication that is used to treat acne as well as hyperpigmentation. And then we have other skin lightening or whitening agents that help to bring about even skin tone.
Great. Can you tell us a little bit about your success rate with clients who come to you with, acne scars or, scars from insects, those types of things?
Sure. I think our success rate is fairly good. One thing that I think our practice is somewhat unique in the aspect that we perhaps have carved out a niche that our #1 visit, or the reason for dermatologic consultations in our office, is hyperpigmentation. So, and if you went across the world and you visited all the dermatologists and other physicians and other medical providers, the #1 condition which would warrant consultation to a dermatologist would be hyperpigmentation. So since we're seeing more and more people with what we call skin of color, so as there's more and more ethnic populations, one cannot ignore these individuals. So it would behoove any dermatologist or any medical or healthcare provider to learn about treatment options. So a lot of these patients are seeking treatments. The people that we are seeing have already been to 5, 6, 7 providers, a lot of them dermatologists, And a lot of them have provided the same treatments, so they went to dermatologist A, then B, C, D, and E, and they didn't get much different types of treatment. So each one just treated them with the similar type of treatment. And so patients did not improve or have satisfactory rates of improvement. So what and as I have been practicing almost 20 years and I've been part of big groups, and the dilemma that I did face being at some of these practices as well is that all of us have the same kind of treatment options. Again, it's very important to get a detailed history, do a detailed physical examination, and only then can we try to tailor specific therapy. And I think when we attempt to look at the underlying cause or the root cause and try to figure out what is causing this melanogenesis or hyper melanogenesis or increased melanogenesis activity, then we can tailor our treatments. And I think understanding vitamins, understanding minerals, understanding antioxidants, understanding skin lightening agents, and understanding the physiologic and the pathophysiologic process of melanogenesis is crucial in order to get success in this. So because I was not getting good results, because I was treating just like everyone was treating, and wasn't fully aware of the implications of what physiologic mechanisms are playing to cause this, I had to learn and go back to the books, did my research, went to classes, got further training, and have at this point, so we have developed some protocols that where people have failed, we are able to help them out.
It sounds to me like you take a very holistic approach to treating patients with pigmentation issues. Because if I hear you correctly, you're saying there's a cause and you kind of have to take a look at the cause before you can treat it, and then you have to take a look at kind of the whole person at the same time. Am I right?
Yes, so that is correct. I think we have to look at the patient as a whole because they could be on medications. They could be getting too much sun. They may not be using the right sunscreen. They may be using products that they're sensitive to and it's causing inflammation. That inflammation then creates chemical messengers causing further inflammation, causing further melanin production, further darkening, and it just is a never-ending vicious cycle. So I think it's important to understand the patient as a whole and look at their whole history, because a lot of times one can fix what may appear to be a very complicated issue, and it may be a very simple issue to correct.
Excellent. Dr. Shah, we've been talking about pigmentation. Tell us a little bit about what's the hardest pigmentation issue for you to treat. How do you treat that, and kind of also tell us a little bit about your success rate with that?
So a lot of people, a lot of patients now are visiting the office for evaluation of pigmentation. Now we're getting many visits, and a lot of these are younger females who are requesting treatment for intimate area pigmentation, so dark spots. So it could be the nipple, areola complex, it could be the underarms, it could be the perianal area, and it could be the private area, the vaginal area, vaginal vulvar area. So they have sought out treatments. And they've been to many providers, and they've been told we don't have treatment options. And as they visited us, I told them many years ago that we do not have treatment options for you. But then as more and more people came, and some of this has stemmed from the adult film industry, and a lot of these people have noticed that these people are not dark in those particular areas, and they wanted and were seeking treatment and are willing to do what is necessary. They're very frustrated and are really seeking help. And as they visited, I felt their pain and wanted to help them out. So what we did is we started looking for therapeutic options for this type of treatment that is not available at many places. Reached out to some of our top-of-the-line skincare companies that have been in business for many years, and they were producing products. I inquired regarding these type of patients that what we typically use for the face is too strong for the delicate areas of the body. So sometimes it's very important to understand that the face and the body, even though it's the same person, the skin is completely different. And the skin on the abdomen or the arms is not the same as skin perhaps at the areola or the nipple area. So that is important to understand, and things that we can use on the face or other parts of the skin on the body, these areas are very gentle and they need to be treated as that. So this was a challenge, a clinical challenge, a dilemma. However, we felt it's necessary to try to help these type of individuals who are seeking our help, who are crying for help, who are needing help, but they're not getting it. So what do we do? So as I talked and had my staff look into this, we were able to get in touch with a few of these companies who are top-of-the-line companies, and they actually are, they've had these products for a number of years. And I asked them, they must, if they can give us protocols. So as it was not in their protocol, they do have doctors who are using this. Where are these doctors? They're out in Beverly Hills. Oh. Who are these doctors? They're treating these Hollywood people. So a lot of these stars, top-of-the-line patients, are getting these treatments, and they're getting excellent results. So what we did is we requested them to reach out to those doctors, and we got their protocols. We got those products, and we have those here at our dermatology practice, and we have been utilizing them, and our patients are happier than ever. So we're happy to say that. So difficult, one of the most difficult, I would say, is these intimate areas. And the other areas are if you have dermal melasma, which is the dermal melasma, which is the deep melasma where the melanocytes. So dermal or mixed. So sometimes if you have a person, so a doctor treats them with melasma and they improve, but not completely. And they say, I'm better, but look at this is still behind. That is what is left, is the dermal melasma. That is what the topical agents or the chemical peels were not able to get. So they didn't reach deep enough, and then that has to be treated. So there are different ways and different techniques that we can use to try to help with this type of dermal pigmentation. That will go away. It will just take time and the appropriate ingredients and appropriate products to be used. So one innovative way that can potentially be used is a glutathione. So glutathione is known as the master antioxidant, and it is a excellent product. It's typically used intravenous because that is the route that it works best. Glutathione is too big or too large of a molecule. It cannot be absorbed through the skin. And if you take it orally, if you take it by mouth, most of it, by the time it goes from the mouth to the esophagus to the stomach, when it hits the stomach, there is hydrochloric acid in the stomach, and that will break down the hydrochloric acid. So about 80% of the hydrochloric acid will be broken down, and less than 20% will be getting to the skin. So, and then intravenous vitamin C would be added as an antioxidant to help brighten, lighten, whiten the skin. So, and then there's other, so it's, again, we can't go into such great detail on what the protocols are, but these are some of the ways. And liver detoxification is a very important part of hyperpigmentation and melasma. So as you talked about the holistic approach, I'm not a holistic physician, I'm not a holistic doctor, but the body, the adrenal gland, the liver, it's all related. And again, another topic for another day, but all of those factors need to really be controlled for optimum results. We have to look at copper, we have to look at sulfur, we have to look at zinc. These are important minerals which many doctors ignore. And that is probably the reason they don't get the results.
Oh, I see. So much actually goes into this, more than I think our viewers would have even imagined.
Yeah, and more than I would have imagined, more than most of my colleagues imagine. I think if I'm actually speaking on many conferences, and I'm trying to enlighten the people and help. It's an exchange of information at some of these conferences. So I think what I would like to impart to, if any of my colleagues are watching, any doctors or any medical professionals, I think we have to learn the physiology of how melanin is synthesized, how melanin is produced, what are the pathways, where can we inhibit, the cycle, and how can we shunt the pathway from eumelanogenesis to pheomelanogenesis, or if there's different areas. I think that's where, so I don't want to get too technical or get into too much information where people may not understand the technicalities of it. But I think, yes, I agree in a short answer. There's a lot more that goes into this than just here's a cream and there you go. And it's not as simple as that. And here's a chemical peel and let's do the peel if you didn't do good with creams and then the peels don't work. Well, maybe they didn't use the right ingredients. So we have really special chemical peels that can go much deeper into the skin than most of these peels. So as I said, I've taken so much training and learning and the process to just understand, because this is a concern of so many individuals worldwide. We get people visiting from Brazil, we're having people coming from Saudi Arabia, people are making appointments in Dubai and they're making calls because they saw us online and they wanted to come and learn. So we're honored by that, we appreciate that, but that just makes us want to do even a better job for these people that are asking us.
So one last question on pigmentation before we move on. A question I've had. Tell me about age spots. It's a darkening of the skin. Is that a hyperpigmentation issue, or is it kind of something completely different?
Yes, so age spots, what we call, so like freckles or dark spots, you get lentigos or lentiginous. So when one goes into the sun, a fair-skinned person, for example, will go into so you have someone like me, and then you have someone who's very fair. So let's say someone like you. So we both go into the sun. So what I have a lot of melanin. Okay, so this melanin is like an umbrella. Think of I have an umbrella. So this melanin is like an umbrella. So I'm out there with an umbrella. You do not have an umbrella. I have what we call eumelanin, you have what we call pheomelanin. Eumelanin is the black-brown pigment, pheomelanin is the red-yellow pigment, okay? And that's what gives it the light color, or the white color, okay? Now, as we go out into the sun, a person goes out, and what happens is the one that has an umbrella can be out there for a much longer time and is not going to really see much of a difference in their skin color. Someone who's fair-skinned will go out into the sun, and within perhaps a few minutes or a short while, they may get red, okay? And that is kind of a sunburn in this individual. They probably are not tanning, they're getting redder. Right. And what's happening is the body is really concerned, And what happens is melanocytes, which are the cells that produce pigment, they come from the basal layer. We call it the stratum germinativum. So they come from the base, or the other call is so we have 5 layers of the epidermis. So they come from the bottom and they migrate up to the top.
Okay.
And what they're trying to do is inhibit that sunlight to cause further damage on the skin.
Okay.
So as more and more melanocytes come, they will form a dark spot.
Oh.
There will be an aggregation of melanocytes, and they'll form what we call a solar lentigo. What that is a body's way and body's reaction to protect it from further sun damage. So it's trying to, so that's what a lentigo is formed, or and then, so those are best. So it is a form of hyperpigmentation. You're accurate. It's made from melanin, but it's in response to protect that person. So sometimes, so if those people get a lot, so you'll get 1, you'll get 2, you'll get, some people get many of these dark, dark spots or lentigos, and they're covered on their arms, they're covered on their chest if they are, sunbathing at the beach, or on their face, and if they don't use sunblock or sunscreen, then they don't have protection. So what will happen then, this is a higher chance of some of these lentigos, or if the sun is too much, if the cells are atypical, sometimes this is where they risk getting melanoma or skin cancer. So that is where the fair skin type, we call them Fitzpatrick skin type 1 through 6, and the person that is so fair and just as soon as they go in the sun, they'll burn. They always burn, versus the very dark skin type who always goes in the sun, who goes in the sun and never burns. So those are comparing and contrasting. So yes, the sunspots and that's where some of these can turn into skin cancer.
Oh, I see.
Okay.
Very good. Now, is your treatment for an age spot any different than some of your other?
Right. So age spot is kind of, it's like a generic term. So sometimes what someone may consider an age spot may actually be skin cancer.
Oh, okay.
Okay. So what someone may see as an age spot may be a precancerous growth.
Oh.
And what someone may see as an age spot may actually be a lentigo or a freckle. So again, so the treatments will vary and they will be different depending upon what we see clinically.
I see.
So what are the type of treatments that we can do? So if it's just a plain lentigo, we can sometimes freeze those with liquid nitrogen. So that's a very simple treatment. Sometimes if they're in the early stages, we can use topical creams to try to lighten these. So sometimes retinoids or bleaching creams or a combination of those may be helpful. Sometimes a chemical peel will be helpful. So a gentle peel in those spots. Sometimes and then skin lightening creams will be helpful. However, a qualified dermatologist, qualified skincare specialist will be the one to look at these. If anything appears dark, pigmented, uneven, irregular, it would behoove us to consider doing a skin biopsy on that before treating. So, so those are the treatments, and we can consider those treatments, or we would do a biopsy if it was felt clinically appropriate under the circumstances.
Right. So any new spots, come see your dermatologist.
Come see the dermatologist. There you go.
Wonderful. Dr. Shah, another area of dermatology that you're an expert at and have a lot of success is the area of anti-aging and rejuvenation. There's a lot of stigma around that. So I'm hoping you can kind of clear some of the concerns and questions that our viewers may have. What are some of the top contributing factors to the skin aging? What exterior contributing factors cause the aging process?
Basically, we can divide aging into two factors. We have intrinsic aging and you have extrinsic aging. So the extrinsic aging results from sunlight, the environment, pollution, etc. So it's whatever's on the outside. Intrinsic aging is basically how we age internally and how we take care of ourselves. So very important would be nutrition intake or diet, how healthy we are if we exercise. So those are the internal. So one of the accelerators, by the way, of the internal aging process is glycation. So glycation is where glucose or too much sugar in the body binds to protein. When that happens, it's causing what we call AGE, and advanced glycation end products. So these are AGEs. And so that's kind of how, so if you really want to age quick, if you want to get wrinkles quickly, then just eat lots of sugar and have a bad diet, and you'll quickly get there. But if you want to slow down the aging process, healthy lifestyle will be of paramount importance. So that's crucial, and that's why diabetics get heart attacks much quicker, or diabetics get ulcers in their legs, because the endothelia, or the endothelial lining, or the blood vessel wall, the type of AGEs, or the AGEs that bind to the blood vessel wall, cause changes in that, causes it to prematurely, so they get atherosclerosis and they get kind of heart attacks much quicker. So this is where, so the heart ages and the blood vessels age, so the same way the skin ages. So that's one thing, that we can limit our intake of sugars. So that will decrease the inflammatory process and really go a long way to trying to keep us healthy. So intrinsically eating healthy. Okay, so that's important.
So
Lifestyle.
Gotcha.
Your extrinsic, which a lot of people, which a lot of work is being done on. So the lifestyle, we have to do ourselves, a lot of it. So we have to make our choices, and doctors can help, but we really need to follow. Now the extrinsic is what everyone, so this is going to be the bulk of our discussion. And so number one, most important, is good sunblock. That will be key and crucial. So you'll probably notice that since we have this I keep calling it the umbrella, in the darker skin types, there's an umbrella that's minimizing the sun damage. Okay, so fairer skinned individuals will get sun damage. The sun emits the three main rays that we know of, ultraviolet rays: UVC, UVB, UVA. UVC does not reach the earth, basically, because the ozone layer filters that out. UVB is B for burn. UVB is shorter wavelength, but it's a much higher frequency. So that causes the burns. So your basal cells, it's a more superficial type of a burn, but and it's mainly out in the summertime. The UVA is your longer wavelength, the ultraviolet ray, and that goes much deeper into the skin. So that's where it will go much deeper and cause your destruction of collagen. So it would damage your collagen, so you'll get the premature wrinkles, the UVA. And it's also found year-round, and it could be even if the sun is not out, it will be there. So someone says, "Doctor, I said, do you use your sunscreen?" "Doctor, I don't. I drive." I said, "Well, the UVA can still come through your window glass, and it will come through the windows. And if you have a 30-minute or 45-minute or an hour drive, you are still getting sun damage, even though you don't think you are." Right. So it's very important to understand. So UVA. So the two things important to know: UVA will cause accelerated aging process or premature wrinkling, and it will cause. It's predominantly responsible for the melanomas. Okay, so that's where. So it was asked. If someone asks you, so it's a very important question. So our students, our residents, when we ask them, so if a patient asks you, should they tan in a tanning booth, or should they tan in the sun, and what would the answer be? And the answer to that is never ever in a tanning booth, because that is basically UVA. Oh my. That's UVA, and that is, so all these young people, a lot of the younger girls, they go and they get this tan, they want to get this artificial tan, and they've been tanning, and sometimes I see these 25-year-old fairly young females who are coming in for skin exams and evaluations, and they've got moles and spots and things that one would not have anticipated that this early, that things like that would start. So, so it's very important that, now we don't recommend that you tan, but if you had to recommend one versus the other, the sun is millions of miles away, so the UVB, UVA, so it's not as strong by the time it gets to us here on the earth. But the UVA in tanning booths is like just a few feet away. Right. So you're really getting that artificial light, and it's damaging. Now, what are some of the things? So the best sunscreen to use should have zinc oxide. So it should have zinc oxide, which is a physical sunscreen, and it blocks your UVA and UVB. So when you're looking for a good sunblock, make sure it has zinc oxide. That's going to be very important.
Is there a certain percentage of zinc oxide you should choose?
Zinc oxide, it comes pretty standard, so most sunscreens will have that. So what you're looking for is broad spectrum protection. That's the key term, broad spectrum protection, UVA, UVB. It'll say that on the sunscreen.
Oh, what are some of the other exterior, external contributing factors?
Right. So as we discussed, the most important is the sunblock. That is number one, and it's crucial. Now, let's say we haven't done that. Now we're beyond, so we got the damage.
Right.
We didn't prevent it. Now we're to the doctor's office and we're like, okay, what can we do? I have these fine lines or I have these wrinkles. So depending upon, so what I wanted to touch on some of the procedures that are out there nowadays, and I wanted to concentrate on two of the most popular procedures that are out there is Botox and dermal fillers. So those are people worldwide are seeking treatment. We get a lot of consultations for that. Now, where does Botox get used? Where does fillers get used? So it's very important to understand. So basically, Botox will come in useful. So this is for our viewers to understand, so they can figure out what category they would be in. If one smiles, so I'll do a smile, and you see these. Mm-hmm. If I frown, you get the 11s, and if I raise my forehead, I'll get the forehead lines. Those are due to muscular movement. Okay, so anytime we're having muscular related wrinkles that result, that is where Botox would be useful. Okay, it's due to muscle movement, and so that's where it would help. Now, for your, let's say, nasolabial folds, or if you want to get your lips done, or one wants to have enhancement, so any wrinkle that's present at rest, for most parts, but like the nasolabial folds and the lips, which are what we see most commonly requested, those are your dermal fillers. So Botox would not work on the nasolabial folds or your lips. So a lot of people want fuller lips, they thin out. The classic is Angelina Jolie lips that's what I want. So They just want to rejuvenate the skin. So those are your procedures that we do in the office, and they're much nicer. They've gotten better and better, the fillers. It used to be collagen we used to inject, and that would last 3 to 4 months. But as the hyaluronic acid fillers have come in, we use Juvederm in our office by the Allergan people. So the Allergan makes also the Botox and the filler. So that's a household name, and they make good products. So they do very well. So we typically use the hyaluronic acid fillers to rejuvenate the aging face. A lot of people now call it the liquid facelift. Mm-hmm. So it used to be where in the past you would go to the plastic surgeon and people would get facelifts, and they would pull the skin up so tight, and it was not a natural look. So a lot of the plastic surgeons have also cut down significantly on doing the facelifting, because that is pulling and stretching the skin. And what we found, the more important thing is volumization of the skin. So volume restoration is important. So one can think of a balloon. So think of a balloon that's completely flat, and then you put air in the balloon and it fills up. that is kind of what the dermal fillers are doing, is they're also putting back lost volume. So
Right.
they're volume restoration.
Great. So, Dr. Shah, what are the steps everyone should be taking on a daily basis to age gracefully?
Yes. Very good question. So aging gracefully, again, I'll start off with sun protection. That's going to be number one. And I think each and every one of us should be on a good skincare product. So skin regimen, is important. Retin-A or the retinoids, that to this day, it's the only cream that has been FDA approved for wrinkle reduction.
Okay.
So all the other products that have come out are there's excellent products. They're more what we would call cosmeceutical. Mm-hmm. So what is a cosmeceutical, just briefly? So you have a cosmetic on which you can get over the counter, and you have a pharmaceutical, which is a prescription based. Now, so if you have a hybrid between a cosmetic and a pharmaceutical, it is called a cosmeceutical. Okay. So cosmeceutical, basically they can make it as strong, almost as strong as a pharmaceutical, but not come to that level. And so a lot of the creams a lot of these companies don't want to go through the FDA because it's millions upon millions of dollars to get the approval. So as long as you're a cosmeceutical, then you don't need the FDA approval. A pharmaceutical needs FDA approval. And the only really FDA approved that received recognition or approval for wrinkle reduction was Retin-A.
Really?
Till this day. And this was in the 60s.
Wow.
So it's really amazing that it stood the testament of time, and it's done so well. So I will always have that as part of our armamentarium. Mm-hmm. We have other things, topical vitamin C would be important. Again, you don't want to get the $5.50 vitamin C that you get from Walgreens, and because there is a difference on the type of vitamin C. And vitamin C basically is a water-soluble vitamin. This, I think, is a very important concept. I think very important, for everyone to understand. And our cell membrane, so on top of our skin, we have the cell membrane, and it's a lipid bilayer. It's made of oil, basically.
Right.
So as we know, water and oil, water cannot penetrate oil, or
Right.
oil will not penetrate water. You'll have two separate interfaces. So how will a vitamin C, which is a water-soluble vitamin, get through the skin, which has oil on it?
Right.
So it cannot. It's just a simple answer, it cannot. So the question then is, well, how do people use vitamin C on their skin? I see them using it all the time. That may be a question that people may be having. So yes, and that's a very good thought. And what it is you have to have a carrier bound to that. So the simple example is you want to get in the White House, you want to go through the White House, you want to meet the president, and you go to the door, there's a security guard, and you want to get in, and they say, do you have credentials? And the person says, no, I want to meet the president. And they say, no, you can't come in. No, I want to meet the president. So what they'll say is, we can't let you in unless you have credentials, or maybe if you know somebody, they can help you get in. So then that person goes and finds someone who knows someone. So they come to the gate with that person, and the security guard will let that person in. So what is the example there? So they wanted to get in, and it cost a fee to get in. They ended up paying a price to that person. They got them in. Same thing with vitamin C, is it has to bind or carry on with someone, and then that in that lipid layer, and then lipid bilayer, the vitamin C just attaches on. That goes through, and the vitamin C, once it's inside, goes its separate way. So but to do that, it's very, very pricey. It costs a lot of money. So I want the viewers to understand that sometimes there are certain skincare creams, and it will be, 5% vitamin C or 10% vitamin C. And I won't say Walgreens or CVS. I mean, you'll find these at your retail stores, but some of the really, truly engineered vitamin C that needs to really get in, Because if you're buying that cheap vitamin C or the inexpensive vitamin C, if you're spending $10 or $15, maybe you could save that money spending it somewhere else, because it's not going to work. You're taking the time, you're taking the effort, but it's not doing the job. So I think it's very important for us to understand some of these properly produced, formulated, developed creams. It takes a lot of research. It's expensive material. So some of these creams are expensive. So if you do go to your dermatologist or you go to your plastic surgeon and they say, well, this is the price, unfortunately, this is not what we set. This is what the manufacturers are doing.
Right.
So it's
so
important.
ensure every one of us every day to take care of our skin, sunscreen, whether it's winter or summer, eat healthy diet, exercise, quality food, veggies, fruits, all that good stuff. Skincare products, proper skincare products, and then lots of vitamin C, right? Did I miss anything?
No, you're good. So vitamin C, I'll just elaborate. So vitamin C can be incorporated, and then a lot of vitamin C would be an excellent antioxidant, and I would highly recommend it. Just so there's no confusion, because you said vitamin C, and I just wanted to elaborate briefly. Oral vitamin C is not going to do much for your skin.
Okay.
So it's very important for us to understand that oral, oral meaning by mouth, that vitamin C will not be absorbed very much. It will be hydrolyzed just like the glutathione. So once you take it by mouth, most of it is broken down by the hydrochloric acid. So oral vitamin C, a lot of people are under the impression, I'll take a lot of vitamin C and I'll get good results on my skin. That is inaccurate. So please be advised of that. Now we do have, so vitamin C either is intravenous, could be used, or if you don't want to do IVs, you don't like needles, you want to get a liposomal form of vitamin C, which is again similar to the concept that it will be encapsulated and that vitamin C will be protected. So it's kind of, imagine a shell on top and vitamin C's inside, and then it will go through the stomach undamaged. And then once it goes from the stomach to the small intestine, then the vitamin C can go and it can get absorbed through the bloodstream. So, but again, so we do offer liposomal vitamin C here and liposomal glutathione, but you really need good top-of-the-line skincare companies, because a lot of these products are being sold on the internet and many places, but really don't stand, they don't have a lot of backing behind them. So I want all of our viewers to be safe and really go to a place that you can trust.
Great. So many of us are probably spending money on products that just aren't really going to do anything.
We're wasting a lot of money
on
a lot of products that we probably shouldn't be doing.
So come see you. You have the good stuff.
We try.